Hi, Swati. Shall we begin?
Yes, please go ahead and start.
Thank you.
Thank you.
Okay, good afternoon, everyone. I'm Zubair Said from the Fairfax County Health Department. I'm a community health specialist on the outreach team. And today we'll be talking about COVID-19 vaccination and vaccines. And with me today is one of my colleagues, Kirsten. I'm going to allow her to go ahead and introduce herself.
Hi, everybody. My name is Kirsten Bushner. I am the newest member of the community outreach team here at the Fairfax County Health Department. It is our pleasure to bring this information to you today, and I hope that we can answer a lot, if not all, of your questions about the vaccine and the vaccination registration process here in Fairfax County. Thanks so much.
I'm going to go back to sharing my screen. So I'll be talking about the vaccine and about COVID-19 vaccines in general and how they work. And after that, Kirsten is going to be talking about how people can get registered for vaccination. And after all of that is done, then we can answer any questions that people may have. So let's start with the numbers. So far in Fairfax County, over 70,000 cases of COVID-19 have been identified. We get around 150 to 200 new cases each day. We've had over 1,000 people who have died in Fairfax County due to COVID-19. Nationally, over 29 million cases and over 539,000 deaths. Of course, the impact of this pandemic has been felt beyond just the numbers itself. But you can see here food insecurity. You can see here mental health impacts, stress, feeling out of control, just a feeling of helplessness overall. Some people are suffering from prolonged illness. Other people have, of course, been impacted economically. And let me talk a little bit more about some of the long-term impacts of COVID-19. So we know that a majority of people, about 80% of people, either they are asymptomatic, they don't show any signs or symptoms, or they recover within a couple of weeks. And that's about 80 to 85% of the population is that way. And then we know about 10% of the population, even less in Fairfax County, are hospitalized, and then 1 to 2% die due to COVID-19. But there's a middle group. There are people who experience long-term effects of COVID-19, otherwise known as post-acute sequelae of coronavirus, PASC. And what happens is basically one of two things. Either someone starts out with pretty severe symptoms, maybe they're hospitalized due to COVID-19 and they get discharged, they recover somewhat, but their symptoms linger and they never really quite go away. Another group of people, they'll never show signs or symptoms. Then maybe they didn't even know that they were infected. And then months later, other symptoms start cropping up. And you can see here pretty much on the left-hand side what some of these symptoms are, including depression. Brain fog is basically memory problems, as well as difficulty concentrating, difficulty focusing, and just kind of feeling out of it. And a lot of people who are suffering with these long-term effects of COVID-19 are experiencing these things. On the right-hand side, these are not as common, but they certainly are occurring with a significant proportion of people who are suffering long-term effects of COVID-19. You can see some of these are very serious. You're talking about heart muscle inflammation, lungs torn apart, kidneys badly damaged. Some people never recover their sense of taste and smell. And some people are experiencing depression as a result of their loss of taste and smell, and just depression in general because of the impact of the disease on their body. And so the point here is that basically, even if you think you're a young, healthy person, it doesn't mean that you're totally immune from the effects of COVID-19. It doesn't mean that, first of all, you can't get hospitalized and die. That most certainly happens amongst younger people. But there are a significant number of people, some studies show up to as many as 30% of people who get COVID-19 will experience long-term effects. And so I really caution younger people that Just because you're young and maybe you don't have any chronic conditions, maybe you're healthy, it doesn't mean that you can't still suffer from this disease in a significant way, which is why really everyone needs to get vaccinated, not just people with chronic conditions, not just older people, but really everyone. Okay, next. So how are we going to end this pandemic? Basically, this pandemic is going to end when 70 to 80% of the population is immune against this disease. You have to remember that this disease is spread from person to person to person. It doesn't just spread by itself, right? It needs to infect someone. The virus needs to multiply many times over, and then it's transmitted, coughed and sneezed out, breathed out to other people. And so it's spread from person to person to person. If enough people are vaccinated against the disease, then the virus can't be transmitted as easily. So when you have a situation when the majority of our county, let's say the majority of Fairfax County, they're not vaccinated or they're still susceptible to disease because they haven't been infected, then the virus has like a free playground to just wreak havoc and get transmitted very easily. But if enough people in our area, in our population in Fairfax County get vaccinated against COVID-19, then the virus has less of an opportunity to be transmitted because these transmission pathways are blocked because there's just simply nowhere for the virus to go. And what that percentage is that we need to achieve herd immunity is not exactly known. We say 70 to 80%. It could be higher than that, maybe 85 to 90%. No one really knows exactly for sure. But the point is we need to really get as many people as possible vaccinated quickly so that we can get this pandemic under control, because there's really only two ways to become immune against this disease. Either you get the disease itself, you become infected, you get COVID-19, in which case we think that you're protected for 6 months or maybe even longer against the virus. So it's probably very unlikely that you will get reinfected with the original strain of coronavirus, but there's of course new variants out there, which we'll talk about. And then there's the vaccine, in which case you can get vaccinated. And you might be wondering, well, how long am I immune against COVID-19 if I get the vaccine? We don't really know for sure quite yet. Some experts say 1 to 2 years, but no one really knows for sure because we're still studying the effects of this vaccine and its long-term effects. But basically, this is the way we need to get this pandemic under control. To achieve herd immunity, basically 70 to 80% or more of the population becoming immune. So COVID-19 messenger RNA vaccines, mRNA vaccines from Pfizer and Moderna, they were approved by the FDA and recommended by the CDC in mid-December. Johnson & Johnson vaccine was approved by the FDA and recommended by the CDC at the end of last month. Each of these vaccines was studied in trials with over 30,000 volunteers, including adults of all ages, women and men, and people of different races and ethnicities. Independent scientists reviewed all the study data before FDA authorization. So all 3 vaccines are safe and effective. And this process is the same that we see with other vaccines. In other words, no corners were cut in evaluating the safety and efficacy of these vaccines. So now I'm going to show 2 short videos that are going to explain how the Pfizer and Moderna vaccines work. The first video that I'm going to show you is going to explain the process in 2 minutes of how DNA goes to mRNA and then goes to protein. And then we're going to be showing another video, a very short video, 3-minute video that also explains how these vaccines work. So I think just by watching these 2 videos, you'll have a very, very good understanding of how these vaccines will work. But after the videos, I will follow up with you. So let me get to the videos here.
Here is a cell, the basic unit of all living tissue. In most human cells, there is a structure called the nucleus. The nucleus contains the genome. In humans, the genome is split between 23 pairs of chromosomes. Each chromosome contains a long strand of DNA, tightly packaged around proteins called histones. Within the DNA are sections called genes. These genes contain the instructions for making proteins. When a gene is switched on, an enzyme called RNA polymerase attaches to the start of the gene.
Dr. Saeed, we cannot see the video.
Making a strand of messenger RNA out of 3 bases in the nucleus. The DNA code determines the
Hello. Did someone say you can't see the video?
Yeah, we're unable to see the video, Dr. Saeed.
Oh, okay. Well, that's not good. Okay, let me get back to the slideshow. Can you see this? Can you see the slide?
Yes.
Okay, I'm not sure why the video, that's actually never happened to me. Okay, all right, well, I'm gonna go ahead and try to explain how the vaccine works without the use of the videos. I hope it's gonna make somewhat sense, but so this is an illustration here of the coronavirus, and you can see here that there are spikes emanating from the coronavirus, otherwise known as coronavirus spike proteins. So what scientists have done is that they have focused on the genetic sequence for coding for these coronavirus spike proteins. And so basically what they've done is they have isolated the genetic sequencing, they've identified it from the coronavirus. And what they've done is they have synthesized messenger RNA from that genetic material from the virus. And basically what messenger RNA is, it's simply instructions that our cells use to make the coronavirus spike protein. And the messenger RNA is packaged into a fatty packaging. And then this fatty packaging allows the messenger RNA from the vaccine to enter cells in our body. Once that messenger RNA gets into the cells in our body, it uses the cellular machinery in our body, protein factories. These protein factories use the messenger RNA to make coronavirus spike protein. So what the instructions that are in the vaccine, this messenger RNA, what it allows our cells to do is actually make a piece of the coronavirus. And the piece in question is this coronavirus spike. So once the messenger RNA gets into our cells make the coronavirus spike protein, just the spike protein. It doesn't make the entire virus. The vaccine itself doesn't contain any portion of the virus. All the vaccine contains is instructions for our cells to make the coronavirus spike protein. Once our cells make the coronavirus spike protein, they display it on the surface of the cell, like you can see here. And it also gets distributed out into the rest of our body. And so then what happens is immune cells come along. These immune cells come along and they recognize the coronavirus spike protein and they say, hey, wait a minute, this doesn't belong here. It's not part of our body. We need to fight this off. And so what the immune cells do is they start producing antibodies to fight off the infection. And the immune system becomes activated in other ways to fight off coronavirus, so that when our bodies encounter the real coronavirus, it's already primed. It already knows what to do to fight off the infection. And this is in essence how messenger RNA vaccines work. So some quick facts about messenger RNA vaccines. You can't get COVID-19 from the vaccine itself. There is no virus in the vaccine, whether dead or alive. The messenger RNA that's in the vaccine, it doesn't interact with our DNA in any way because DNA is in the nucleus of our cells and the messenger RNA never enters the nucleus. So there's no interaction of the messenger RNA from the vaccine. There's no danger of it interacting with the DNA in our cells. And then you may be wondering what happens to the messenger RNA once our cells make the coronavirus spike protein. Remember, the messenger RNA, it's just simply instructions to teach our cells how to make coronavirus spike protein. Once our cells actually make the coronavirus spike protein, the messenger RNA simply gets degraded. It just simply dissolves and goes away. And then lastly here, these vaccines don't contain any type of tracking microchip. No vaccines contain any type of tracking microchip. That's just a myth. So, okay, now, how could these vaccines be made so quickly? Because maybe you've heard that vaccines take a very, very long time, years, to develop and test and so forth. So some people have some hesitancy to get these vaccines because they say, well, other vaccines take so long to get tested and developed. So how can I trust that these vaccines are really safe? And so there's a few things to mention here. First of all, coronavirus isn't a new virus, right? I mean, it's coronavirus refers to a family of viruses. And there are other coronaviruses that we have seen before, like SARS from 2003. There's Middle East Respiratory Syndrome, or MERS, from 2013. And then there are some common cold infections that are caused by coronaviruses, which have been around for decades. So we've known about coronaviruses for a very long time, and we've been studying them. Another thing to keep in mind is this messenger RNA vaccine technology that I just talked about. It's not new. It wasn't just developed last year. It's been around for more than a decade. And so that vaccine technology was in place and ready to go. All scientists and researchers had to do was identify and isolate the genetic sequencing from the coronavirus. Once they do that, and they can do that relatively quickly, then once they did that, all they had to do was like plug in that information into their messenger RNA vaccine technology to develop a new vaccine. So the technology was already in place. We just needed a genetic sequence from a virus to plug it in and play, so to speak. And then another thing to keep in mind is the massive amounts of money that were thrown at this project in Operation Warp Speed. So usually what happens with vaccines is that usually they go through testing, and then if they're shown to be safe and effective, then they are mass produced, right? But in this situation, because we had a lot of money to spend, they were mass producing vaccines while they were being tested. So that if, for whatever reason, in the trials, the vaccines were not shown to be safe or effective, they would have simply thrown out all of those doses of vaccine because they had money to spend. But because all the vaccines were shown, at least the Pfizer and Moderna and the Johnson & Johnson that I'm going to talk about, because they were shown to be safe and effective, once they were deemed to be safe and effective or approved by the FDA, they could ship it out. So like you notice with the Johnson & Johnson vaccine, it was approved at the end of February, and beginning like March 1st or 2nd, they were already getting into people's arms. And the reason for that is because they were mass producing the vaccine as the trials were going on, which is not usually the way things are done. So these are some of the reasons as to why the vaccine came out as quickly as it did. But again, no corners were cut in evaluating or approving the vaccines, the types of studies, their size, and the independent scientific review before approval are the same as we see with other vaccines. So looking at some of the clinical trial results, in the Pfizer trial, we had around 43,000 participants. We had an efficacy of around 95%, which is very high. Other vaccines don't get into the 90 percentile range. Very few do. So the fact that this was able to do that was really amazing. And this 95% efficacy refers to preventing moderate disease, okay? Meaning you're showing signs and symptoms, it's getting you moderately sick. Here it says 9 out of 10 severe cases were in the placebo group. So what does that mean? That basically means that, first of all, when you're looking at vaccines, you're testing them in trials, you give the vaccine to 2 groups. One group gets the vaccine and the other group doesn't get the vaccine. It's the placebo group. And then you test which groups are better able to prevent infection, and which groups are you seeing severe cases of COVID-19. So what they found in this particular trial, this particular analysis, is that they had 10 severe cases of COVID-19. 9 of those 10 cases were in the group that did not get the vaccine. So what does that tell us? That tells us that this vaccine is very effective or efficacious at preventing severe COVID-19, which is really good. And this vaccine was shown to be efficacious across all age, gender, racial, and ethnic groups. And no serious safety concerns were observed. Just some local reactions. We're talking about side effects such as body aches, headache, fatigue, chills, fever. They just last for like 2 to 3 days or less. They're not symptoms of disease, but rather they're side effects, meaning that the body is reacting, the immune system particularly is reacting to the vaccine. So it's nothing to be concerned about, but they're just local side effects. Now, they are more prevalent and they are a bit stronger with the second dose. And the reason for that is simple. With the first dose, if you haven't ever been infected with the virus that causes COVID-19, your body has never seen what the vaccine is introducing to your body. So the immune system may react somewhat, but it's not going to react that much. But with the second dose, you're basically reminding the body, hey, don't forget about this coronavirus spike protein. And since the body has already seen it before from the first dose, it's going to react more strongly with the second dose. So in some people, not all people, in some people, they experience more of a stronger reaction with the side effects, particularly with the second dose. And we know it's more common in women than men. And we know it's more common in younger people versus older people. So why is that? Really quickly. So side effects are more common amongst younger people because younger people have a more robust immune system. And since they have a more robust immune system, their immune system is going to react more strongly. Women also tend to have a stronger immune system. Their immune systems react more vigorously, which is why side effects are also more common amongst women compared to men. Okay, how about the Moderna trial? I'm not going to go over all of it again because it's all pretty much the same thing. But again, the main point here is these trials were shown to be very safe, very effective, no serious safety concerns. Some really quick comparison between the Pfizer and Moderna trials. Pfizer, the vaccine we can give to individuals 16 and above, but Moderna, it's 18 and above. There's lesser of a dose in the Pfizer compared to the Moderna vaccine, which is really irrelevant because the vaccine efficacy is just about the same, 95, 94%. The Pfizer vaccine is administered in 2 doses, which are spread apart by 3 weeks or 21 days, whereas the Moderna vaccine is administered in 2 doses, but spread apart by 4 weeks or 28 days. The Pfizer vaccine requires a special freezer because it contains more of that fatty packaging that I was talking about before, and so that it requires a special freezer, like temperatures like -94 degrees Fahrenheit. I did put an asterisk here because the studies have now been done to show that the Pfizer vaccine can be kept in a normal freezer for up to 2 weeks without any problem to the vaccine. The Moderna vaccine has less of the fatty packaging and therefore it can be kept in a normal freezer all the time. Both vaccines use the same exact messenger RNA technology. There's just some tiny differences in the messenger RNA code, but both use the same exact technology. So what about people like you and me? So looking at the Moderna COVID-19 clinical trial data, you can see here that they looked at different groups. Different groups of people were included in the trial. They broke it down by age, 18 to 64, and then older individuals, 65 plus. You can see here that the vaccine efficacy was still very high amongst both groups. Now, it did drop somewhat in the older age group from 96% to 86%. And that's simply because older people, again, their immune system doesn't work as well. And we see the same thing with flu vaccines, that they're not as effective in older people as they are in younger people. But again, 86%, man, that is very, very high. So these are very good percentages. And then looking at different racial ethnic groups, you can see here they looked at Caucasians, African Americans, Asians, Hispanics. The vaccine efficacy was very similar, very high. And then here, finally, they looked at people who had chronic medical conditions, because we know that people who have like diabetes and heart conditions and kidney disorders and other types of conditions, chronic long-term conditions, that they are higher risk for developing severe COVID-19. And so they looked at such individuals and they found that the vaccine efficacy was 96%. It was so very high. And then they looked at relatively healthy people And they still found that the vaccine efficacy was still very high, 94%. So good numbers, good data all around. So again, there were no specific safety concerns identified in subgroup analysis by age, race, ethnicity, medical conditions, or prior COVID-19 infections. Again, this is according to an FDA briefing document in December of last year. Now let's talk a bit about the Johnson & Johnson vaccine. The Johnson & Johnson vaccine, at the end, the endpoint of the vaccine is the same as the messenger RNA vaccines, but it starts out a bit differently. So instead of using messenger RNA as the start point, it uses what we call an adenovirus vector to deliver instructions to our cells to make the spike protein. So basically, the common thing amongst all three vaccines, Johnson & Johnson, Pfizer, and Moderna, is that they're basically designed to teach our cells to make the coronavirus spike protein. But the way the Johnson & Johnson vaccine does that is a bit different, and I'm going to talk about that in the next slide. But the Johnson & Johnson vaccine is administered in one dose. They had around 45,000 trial participants. They also looked at different age groups. They also included people of different races that you saw in the previous slide. And here are some of the results. So looking at the efficacy globally, and this is looking again at the prevention of moderate disease, they found that it was 66% efficacious globally. If you looked at the American trials, it was about 72% efficacious. But this vaccine is 85% effective at preventing severe disease. And when you're looking at the main thing, which is preventing hospitalization and death, it was shown to be 100% effective, which is the same as the Pfizer and Moderna vaccines, which are also 100% effective at preventing hospitalization and death. So this is the Johnson & Johnson vaccine is another great vaccine in our arsenal against COVID-19. And it's not being given only to underserved populations. It's not an inferior product or an inferior vaccine. It's being given to all populations, and it's a very excellent vaccine. And another good thing about it is that instead of being stored in a freezer, all that's required is that it be stored in a regular refrigerator, which is important just because it gives greater accessibility. It can be administered more easily because you don't need a freezer or a special freezer. Now, let's talk a little bit about how the vaccine works. So the starting point for the Pfizer and Moderna vaccines was messenger RNA. But this vaccine, the Johnson & Johnson, contains DNA. And is this DNA in fatty packaging? No, it's not. It's not in fatty packaging. This DNA is packaged into an actual virus called an adenovirus. Now, this adenovirus cannot cause disease. Okay, they've disabled it. So what do I mean by that? They've gone into the DNA of this virus and they've modified it so that it can't cause disease in people. Basically, the virus won't be able to copy itself inside of our cells. So there's absolutely no chance that this virus can cause disease in people because it's been disabled. And the other way the DNA has been modified is that they have added a piece of DNA to this adenovirus that will code for the coronavirus spike protein. So this virus is in the vaccine, the Johnson & Johnson vaccine. The virus gets to one of our cells in our body, and the adenovirus will actually come inside the cell. And then what happens is this virus will find its way to the nucleus of our cell and inject the DNA, the modified DNA. And this DNA then gets converted, or actually we say transcripted, but you can say it gets turned into messenger RNA. And then this messenger RNA is then read by protein factories in our cells to make the coronavirus spike protein. And then the coronavirus spike protein is displayed on the surface of the cell and distributed throughout the body. And then the immune system recognizes the spike protein as foreign and says, hey, we need to fight it off. It produces antibodies. The immune system gets activated to fight off the infection. So this part of the way this vaccine works is exactly the same as the Pfizer and Moderna vaccines. It's just that instead of starting with messenger RNA, it starts with DNA, which needs to get converted to messenger RNA, and then the rest works the same as the Pfizer and Moderna vaccines. So what about vaccine safety? What do we know and what do we not know? So In terms of, again, the side effects, some people had pain and soreness in the arm where they received the shot. Some others had fever, chills, headaches, muscle aches, and tiredness for up to a few days. For me personally, I had soreness around my injection site for around 24 hours with the first dose. With the second dose, I got more of a reaction, and that lasted for 36 hours. And again, by reaction, I mean headache, I had muscle aches, I had tiredness, and that lasted for 36 hours. And then it went away and I was completely fine. Now, a small fraction, like less than 1%, may experience a red, itchy, swollen, painful rash that appears a few days or a week after vaccination. If you get that, there's no cause for alarm. It won't last. It just lasts for a few days and then it goes away. But that is a very tiny fraction of people who get vaccinated may get that, particularly with the Moderna vaccine. I don't think it's as common with the Pfizer vaccine. Now, rarely people had an allergic reaction, which can be treated. So allergic reactions to vaccines are nothing new. We see this with other vaccines, but they're very rare. They're very rare events, but they can occur. So let's take a minute to talk about it. So one type of allergic reaction occurs within minutes, like within 15 minutes of getting vaccinated, someone can get difficulty breathing. If that happens, there are trained medical staff on site where you're getting your vaccine, and they will administer epinephrine and you'll be fine. You won't die, nothing will happen, you'll be okay. Okay. Another type of allergic reaction occurs 4 hours after getting vaccinated, and it can result in swelling and hives and even difficulty breathing then. Anytime you have difficulty breathing, let's say you're at home and you have difficulty breathing, you should call 911 right away. But again, these allergic reactions are very rare. And if you've had an allergic reaction that I just described, either you have an immediate one, or maybe you have one 4 hours after you got a vaccine in the past. If you have any of these types of allergic reactions in the past to other vaccines, then you should consult with your doctor, your primary care doctor, to see if it's okay for you to get these COVID-19 vaccines. Most likely you will be able to, there's no problem, but still, it's always a good idea just to consult with your doctor because they know your past medical history and everything. If in that event you have had allergic reactions to vaccines in the past and you do get the COVID-19 vaccine, just know you're going to be observed for 30 minutes following the vaccination. Everyone else will get observed for 15 minutes, but if you've had an allergic reaction to vaccines in the past, you get observed for 30 minutes. Now, what if you know that you have an allergic reaction to any component in the vaccines? Can you still get the COVID-19 vaccines? In this case, the answer is no. So you should consult with an allergist immunologist to see what your options are in terms of COVID-19 vaccination. How about if somebody got the first dose of either the Pfizer or Moderna vaccines and they experienced an allergic reaction? Can they still finish it out and get the second dose? The answer is no. You will not get the second dose. Again, consult with an allergist immunologist, which is a doctor specialized in that field, to see what your options are in terms of COVID-19 vaccination. How about if you have an allergic reaction to food like peanuts or some other type of food substance? Or what if you're allergic to penicillin or other types of medication? Can you get the COVID-19 vaccines? Again, the answer is, or I should say the answer in this case is yes, you can get vaccinated. So allergies to food and medicine, not a contraindication for COVID-19 vaccination. So again, no serious side effects have been found that are caused by this vaccine. No deaths attributed directly to this vaccine, and nothing serious. We've given this now to over 100 million people have gotten these vaccines. We haven't observed any major problems. So very safe and very effective. As more people get these vaccines, the CDC, of course, is tracking whether any serious side effects will occur, and they will provide updates as we learn more. And this is the same procedure in terms of monitoring vaccines after they've been approved and they're administered, to follow up and monitor their safety. This is the same thing we do with other vaccines. Let's take a couple of minutes to talk about variants. What are variants and how do they arise? So the way viruses operate is that the way they cause disease is they get inside of our bodies, they infect our cells, and they use our cells to make many more copies of themselves before they get spit back out and infect other cells. And so that's what basically viruses are busy doing. They're just busy making copies of themselves constantly. And because this virus, the virus that causes COVID-19, is everywhere, it's all over the world, and it's infecting millions upon millions of people, you can imagine that there are so many millions of copies of the virus being produced every day, So as the virus keeps on making these copies of itself, it might make mistakes here and there in that copying process. And these mistakes can result in mutations that change or alter the virus. Now, most of these changes are not going to impact our health in any significant way, but sometimes you can get a mutation that will cause the virus to become more dangerous. And one example of that is the UK variant, the variant that was first recognized in the United Kingdom. This variant has been shown to be 50% more contagious. Now, COVID-19 by itself, it's already very contagious, okay? It's much more contagious than seasonal flu. And now, if you have this UK variant, which is 50% more contagious, well, that just means that it can spread very fast, very quickly. And so that's one bad thing about that variant, you could say. And another bad thing that we've learned about this variant is that it's more deadly. Initially, they said it was 30% more deadly. And since then, subsequent studies have shown that it is more deadly than the original coronavirus. So that's not good. But the good news about this variant is that the vaccines which we have are doing a good job protecting against this particular variant. So that's good. Now, there's the South African variant. Now, this variant, the vaccines are not protecting as well against. They do provide more than 50% of people protection, but the efficacy does drop down significantly. And so they are going to be looking at developing booster doses to accommodate for this South African variant. Then there's the Brazilian variant, which recent studies have shown the Pfizer vaccine is showing that it is protective against the Brazilian variant, which is good. And since the Pfizer and Moderna vaccines are so similar, I think it's a good bet to say that the Moderna vaccine probably is also very effective at protecting against this variant, but I don't have data to back that up conclusively. And then there are other variants as well. There's the California variant, there's the New York variant, which has shown to be somewhat resistant to antibodies that are produced in response to the original coronavirus. There is also some evidence to show that they're more contagious. And there are other variants as well that are popping up left and right. So basically the bottom line is the longer this pandemic rages, if it just spreads unchecked, then we're going to get more variants, because more infections of people results in more copies of the virus, more opportunity for the virus to change, more variants, and these variants can be more contagious and more deadly. So we don't want that to happen, obviously. So if we can all get vaccinated fast enough to protect ourselves from getting infected, the virus won't be able to infect more hosts. And if it can't infect more hosts, it can't copy itself. And so then there won't be as many variants, and we can get this pandemic under control. Now, right now, some of these pharmaceutical companies, they are already in the process of testing vaccine booster doses that are going to protect against these variants. And my guess is we'll probably be getting vaccine booster doses every year for the next few years or so. But let's see what happens with that. But that's probably how the situation is going to play out. Now, there are other things that we can do to protect ourselves against COVID-19, and we need to not stop doing these things. We need to keep on doing it. We need to keep on wearing face masks. We need to keep on social distancing, and we need to keep on washing hands. Now, you might say to yourself, well, if I get the vaccine, and you're quoting all these high percentages about preventing moderate infection and preventing severe death and severe disease and death and hospitalization and so forth, why can't I just stop wearing face masks? Because we don't have enough evidence to show yet, as of today, that these vaccines definitely prevent transmission of the virus. You may not feel sick, but maybe even after getting vaccinated, You may not feel sick, but maybe you're still transmitting disease to others. And we don't want that to happen. And since we don't know that for 100% certainty, then we need to keep on wearing face masks until we're very sure that vaccinated people don't transmit disease. Now, there is evidence to show that from like studies out of Israel and elsewhere that the vaccines are having an impact on disease transmission, namely that vaccinated people are much less likely to transmit disease. But we need more studies to verify that. We still need to make sure that that's 100% true. My guess is, of course, that the vaccine will impact disease transmission, but to what degree is uncertain. We don't know how much of an impact on disease transmission these vaccines are having, but my guess is it will have probably a very large impact, but let's see. But until we get the green light, we all need to keep on doing these things because we have these variants, like I talked about. And so if we stop wearing face masks, if we stop socially distancing, then what's going to happen is that when you have a UK variant, which is 50% more contagious, it's just going to spread like wildfire. And we don't want that to happen. So please, everyone, keep doing these things and don't let up so we can get this pandemic under control. Now I'm going to hand it over to Kirsten, who's going to talk about how to register for the vaccine. But Kirsten, before you get there, I forgot there's one more slide I have to cover, and then I'll hand it over to you. So really quickly, this is a slide talking about modeling from the University of Virginia, which is basically summarizing what I just said in a visual way. So let's go over these 3 scenarios really quickly. So in this scenario, this graph is looking at the current or the original or the wild type coronavirus strain under current mitigation methods. And by current mitigation methods, I'm talking about wearing face masks, socially distancing, washing hands, and vaccination. That's what I mean by current mitigation. So looking at current mitigation and looking at the original strain of the coronavirus, what this model is showing is that if we do these things, we can get this pandemic under control because you can see here that the cases, they decrease. Okay, all right, how about this situation, in which case we're looking at new variants of coronavirus, but we keep on doing what I just said, which is to do all of the hand washing, face masks, vaccination, and so forth. What will happen in this scenario with the new variants? The modeling shows that, again, we can get the pandemic under control, but there is some degree of latitude here. So the modeling isn't entirely clear. In other words, there could be a resurgence of cases because of the variants, but then after a while, it will drop down. So that is also a pretty good situation in terms of getting the pandemic under control. But if we have a situation, and this is the take-home point, where we have these new variants, which are already spreading, the CDC has already said the UK variant is expected to be the predominant strain in the United States this month. And indeed, it's spreading everywhere. So we have new variants spreading, but if we let up on mitigation, if not enough people get vaccinated, if people let up on face masks too soon, if they don't socially distance, then we have a situation where we're going to see a sharp increase in cases, and we're going to see future waves of disease. And that's what this modeling from the University of Virginia predicts and pretty much verifies everything I was just saying in the past couple of slides. Okay, with that now, Kirsten, I'm going to turn it over to you to talk about a vaccine registration.
Thank you, Zubair. So as Zubair was mentioning, we do want to move on to questions and issues about our vaccination program. As Zubair said, vaccination is recommended for everyone, but unfortunately, supply continues to be limited. I'm sure some of you have had encountered sort of longer waiting lines. If you're interested in getting the vaccine, there's been some wait time there. And we apologize for that and appreciate very much your patience. But because vaccine supply here in Fairfax County is limited, the available supply is being targeted to specific groups based on recommendations from the CDC and the Virginia Department of Health. And the idea here with prioritizing groups, we're trying to balance 2 goals. The first goal being to prevent serious illness and death. So among those folks who are most likely to have complications, hospitalization, or death from COVID. And then the second goal is to preserve societal functioning, right? So that, regular sort of business type of things can continue as normal, as always. So we are currently in phase 1 of 2, and within phase 1, there are several sub-phases, if you want to call them that. We have moved into phase 1B. One phase 1B, we keep adding categories to phase 1B. So right now, up through now, we are vaccinating anyone who is a long-term care facility resident and persons 65 and older, as well as persons 16 to 64 with high-risk medical conditions. So those, again, are the folks where we are trying to prevent serious illness and death among these groups. In order to preserve societal functioning, we are also vaccinating healthcare personnel and certain frontline essential workers. Next slide. So among the frontline essential workers, as you can see, we are, if you look at the left-hand column, we are essentially vaccinating all of these folks highlighted in red. And then that comprises about 30 million people in the entire United States. So that's quite a big group. In Fairfax County, that's also a fairly sizable group. So we started with police, fire, and hazmat workers, folks who work in corrections facilities and homeless shelters. FCPS and all of the other public and private schools in the area have been vaccinating their staff. Also anyone who works in a preschool or childcare type of environment also can get the vaccine. And then recently added is food and agriculture workers, people who work in manufacturing, grocery store workers. I'm not quite sure about public transit workers and mail carriers as of yet. I believe those are not quite yet added to the list. And then once we get through all of those folks, then we will be able to vaccinate. The vaccination will open up to other essential workers. As you can see on the right-hand side, anyone who works in transportation and logistics, food service, housing and construction, finance, IT and communications, energy, media, legal services, public safety, engineers, and water and wastewater management type folks. Next slide, please. So in an effort to get vaccinations out to people in these targeted groups as soon as we can, we have been developing different approaches as we go along. And we recognize that there have been a few, some sort of bumps in the road that I think we're doing a pretty good job. I can tell you that everybody here on staff is working almost every single day of the week, many hours to try and make sure that everyone who wants a vaccine can get the vaccine. So we, again, appreciate your patience in that process. So anyway, when it's your turn, the way you're going to find out, we have multiple channels of information. The health department has a website. I will share the links with all of you in a little bit. They're in one of the upcoming slides. We also communicate through social media. There are also other communication methods that we have, such as the Golden Gazette for older adults. So there's lots of different ways. It's also posted on, television news shows, and you can always call our number to find out. I will also share that phone number with you in a little bit if you have any questions about coronavirus in general or the vaccination process specifically. So currently the vaccine is being administered by the health department. It is also being administered by hospitals, Inova, certain private doctors who have signed up to provide the vaccine to their patients. Several pharmacies are also now receiving allocations directly from the federal government, CVS, Safeway pharmacies, and then the health department is working with other pharmacy chains to also work together to vaccinate folks. So one thing that's really important is that vaccination is free. The government is paying for the cost of the vaccine. So you should not pay a single, red cent, not a single dime out of your own pocket for the vaccine. If you are asked, for example, if you go to a vaccination clinic and are asked to provide insurance, that's so that you know, the pharmacy or whomever, you know, they're incurring their costs and they can go ahead and charge the insurance company, but you will not have to pay anything yourself. So they might charge a fee to the federal government for vaccinating you, but again, it'll not come out of your pocket. And then there is some information that is collected at the registration point. And this is only so that we can know who has gotten the vaccine. We're actually trying to figure out, you know, there are certain places in Fairfax County that are more likely to get vaccinated and some folks in different zip codes who are less likely to get vaccinated. And so it's just helpful for us to know, you know, where we need to focus our vaccination efforts moving forward. And then for those of you who do get the 2-dose vaccines, whether it's the Pfizer or the Moderna vaccine, it's a way for us to remind you, okay, like your second dose is due. But I do want to reassure everyone that none of your information is ever shared with any other agency or entity outside of the health department. So your information is private, and we value your privacy. Next slide, please. So as I mentioned earlier, we are currently accepting registration for, you know, anyone who is one of the frontline essential workers on that list, as well as folks who are 65 years old and above, as well as folks who have chronic medical conditions. There is a specific list if you go on our registration site here. The link is posted on this slide, and we can also post it in the chat. The medical conditions include things like cancer, asthma, obesity, any kind of problem that you might have had with your heart, your lungs, liver, kidneys, history of stroke, things like that, things that put you at higher risk for severe illness from COVID. And I also want to point out that phone number that is right there in the middle of the screen, the 703-324-7404. If you are having trouble, you know, getting on the registration site through the link that's posted there, or you speak a language other than English, or you don't have easy access to technology, you can call this number and someone will help you register for your vaccine appointment. I do want to note that if you are a Spanish speaker, you can now register online. There is now a Spanish, the form is in Spanish if you would like to use that, that form directly. Next slide, please. And so that pretty much wraps up our presentation. There are lots of questions that, sorry, can you go back to the previous slide? There are lots of questions that people have, a lot of the similar questions. For example, many people ask, what are the ingredients of the vaccine? You can find that on our online FAQs, frequently asked questions page at the website at the bottom of the slide there. You can also, as I said, call the health department and ask these questions at 703-267-3511. I saw that in the chat there were people asking whether, you know, someone with cancer or someone who is contemplating getting pregnant can get the vaccine. All of those questions, again, are answered through the frequently asked questions page on our website. And I think we have about 6 minutes left in our presentation. So I think we want to open it up for your questions if you have some. I know I was trying to answer the questions in the chat, and perhaps you all are interested in just asking any other questions you may have. Swati, do you want to go through the chat and just make sure that we've answered everything, or how did you want to manage that?
So Kirsten, I can see the questions in the chat, and let's take them one at a time. So can you see the questions as well?
Yes.
Okay. So do you want to answer them live? You can read the question aloud and just answer it.
Sure.
Thank you.
So
Okay.
Zubair, the first question is, how long does an individual have antibodies before receiving or after receiving the vaccine?
How long does an individual have antibodies? Okay, so that's alluding to immunity after you get vaccination. So again, we don't have a concrete answer for that. No one really knows for sure how long those antibodies will be circulating. Again, I would say like a few months ago, people were saying like 1 year, 2 years. That's an estimate really, and we don't know. Just don't have enough information, and hopefully we'll find out more later this year. Let's see, the next question. General statement, make sure your primary care physician knows you got the vaccine. I know later this year I will need my tetanus shot and shingle shot. Yeah, anyway, I think it's just always a good reminder to consult with your healthcare provider about COVID-19 vaccine. Let's see, what else? When do you expect Fairfax County to begin vaccinating those to consider to be in the general population? So, President Biden has said by May 1st, they're going to have enough vaccine for every adult in the United States. I think we're on track for that. So I think for the next month or so, we're going to be still in this vaccine shortage phase where we're phasing vaccines to different groups of people. I think in a month or so, you'll start seeing that it's going to become more and more widely available. Definitely by the time we get into May, every adult in the United States who wants to get a vaccine will be able to get one. Let's see. What else?
Zubair, did you see the question? If you had COVID-19 and recovered, is it still recommended to be vaccinated? If you have the antibodies, why vaccinate?
Because we don't know for how long you're going to be immune against COVID-19, even after being infected. So we say up to 6 months, maybe longer, but no one really knows for sure. And we also don't know the degree to which you'll be protected. And we don't know that just because you got the original coronavirus, that you still can't get reinfected with the other strains. And in fact, what we're seeing in other countries is that even if you got the original coronavirus, you can still get reinfected with the strains, with the new variants. So that's another reason. And because we have seen so far that the vaccines protect against the variants pretty well, particularly against the UK variant. I told you that the Pfizer vaccine appears to be protecting well against the Brazilian variant. So, and even against the South African variant, even though the efficacy drops down somewhat, it's still more than 50%. That's very significant. So for all of these reasons, even if you've gotten COVID before, you should still get vaccinated because it's going to give you the protection against the variants as well.
There's also a question here. Can you choose which vaccine you get if your doctor recommends you to get a certain one? At the health department, we are telling people that you should get the vaccine that is available to you on the date of your appointment. But I don't know, Zubair, if you wanted to add anything to that.
Yeah, it's unlikely that people will get to choose anytime soon. So the best vaccine really is the one that is available to you. The one that you can get is the best vaccine. All three are very safe. All three are very effective, particularly against hospitalization and death. And that's the main thing. So I have no hesitation in recommending any of the three vaccines to everyone. And certainly that's what the health department encourages people to do, is to get any vaccine that they can get.
Exactly. I see a question at the bottom. If you've had the vaccine, will you test positive on an antibody test so that if someone doesn't test positive for antibodies after the shot, it wasn't effective? I'm going to let you take that one.
So so once you get vaccinated, and your body will start producing antibodies to the virus. So yes, you will obviously test positive for antibodies to coronavirus. The second part says, what if someone doesn't test positive for the antibodies after the shot? Okay, first of all, they're not routinely testing for antibodies after somebody got vaccinated. That's not a routine test. It's not something that's being done. We've already gone through the trials. We've already gone through the phase 1 trials where they look at how the vaccine, how the body responds to the vaccine. So they've looked at it in lab conditions to see that yes, antibodies do get produced. We just don't know for how long. Now, I also said, though, that the immune system responds to the vaccine in 2 ways. One is that the body starts to produce antibodies to coronavirus. But I also kind of alluded to and said very broadly and generally that the immune system gets activated in other ways. So other immune cells in the body, like T cells, also get activated to fight off coronavirus. We don't really have time to go into the particular details of all of that, but all of that to say is that yes, antibody production is one way the body fights off coronavirus. It's not the only way. The immune system gets activated in other ways to fight off the infection as well. And so antibodies is certainly not the only measure, but again, anyone who gets the vaccine, you're going to get antibodies against coronavirus to fight off the infection.
Dr. Saeed and Kirsten, we're at the top of the hour. I want to take the time now to thank both of you for this very important, relevant, and timely information. I also want to thank all the attendees who are here today that took the time to listen to this presentation. Thank you all for attending. With that, we end today.
Okay, thank you. Thank you very much.
Thank you.
Thank you.
Bye.